managing status epilepticus. Imagine a seizure that does not stop. Every minute matters. The longer the brain continues seizing, the greater the risk of permanent brain injury, coma, or even death. Today, we're breaking down this important 2025 clinical protocol for managing status epilepticus, also known as prolonged seizures, in a simple, step-by-step way that anyone in healthcare can understand. This infographic focuses on one major concept: aggressive, time-anchored escalation. That means clinicians must act quickly and escalate treatment based on time. They do not wait around hoping the seizure will stop on its own. The protocol is divided into 3 critical phases. 1, phase 1, first-line treatment. 2, phase 2, second-line treatment. 3, phase 3, refractory status epilepticus. Let's go through each phase carefully. Phase 1, first 0 to 5 minutes. In the first 5 minutes, the goal is simple: stop the seizure immediately. The gold standard medications here are benzodiazepines. The preferred option is lorazepam 4 milligrams IV if intravenous access is already established. But what if there is no IV access? The protocol clearly recommends midazolam 10 milligrams intramuscularly, especially in emergency or pre-hospital settings like paramedic arrival. One of the most important messages in this section is, open quote, treat any convulsing patient immediately, close quote. Clinicians do not wait passively for the seizure to continue. The infographic presents an important clinical scenario. Paramedics arrive and discover a patient actively seizing. Family members report the seizure started only 2 minutes ago. The question is, should healthcare providers wait until the seizure reaches 5 minutes before treating? The answer is no. The 5-minute mark defines status epilepticus, but treatment should begin immediately if the patient is actively convulsing. The protocol emphasizes a critical phrase, open quote, time is brain tissue, close quote. Every minute of uncontrolled seizure activity increases the risk of neuronal injury. Phase 2, 5 to 15 minutes. If benzodiazepines fail to stop the seizure, clinicians must rapidly escalate to second-line anti-seizure medications. The goal during this phase is stabilizing abnormal brain electrical activity. Common treatment options include levetiracetam, 60 milligrams per kilogram, valproate, 40 milligrams per kilogram, fosphenytoin. Now here is one of the most important warnings in the entire protocol. Open quote, underdosing is the #1 cause of treatment failure, close quote. Historically, insufficient dosing allowed seizures to continue. That is why modern 2025 protocols emphasize aggressive, weight-based loading doses to maximize effectiveness. Half phase 3, after 15 minutes. If seizures continue beyond 15 minutes, the patient is now considered to have refractory status epilepticus. At this stage, the situation becomes extremely dangerous. The patient is at very high risk of brain damage, respiratory failure, death. The protocol now requires aggressive critical care management. The patient must usually be intubated, placed on mechanical ventilation, given continuous anesthetic infusions. Common medications include propofol, midazolam infusion. Essentially, clinicians place the brain into a medically induced coma to stop the ongoing electrical storm. The CEEG mandate. One of the newest and most important recommendations is the use of continuous EEG monitoring, also called CEEG. The protocol recommends starting continuous EEG within 1 hour for refractory cases. Why is this so important? Because even if the visible shaking stops, the brain may still be actively seizing internally. This condition is called non-convulsive status epilepticus. Only continuous EEG monitoring can confirm whether seizure activity has truly stopped. That takeaway. So what is the biggest message from this 2025 protocol? Act fast, escalate fast, dose appropriately. Status epilepticus is a neurological emergency where delays can permanently damage the brain. The treatment strategy follows a strict timeline. Benzodiazepines first, rapid escalation to anti-seizure medications, ICU-level anesthetic therapy if seizures persist, and throughout the entire process, open quote, time is brain tissue, close quote. Thank you for watching. If you found this clinical breakdown helpful, don't forget to like, subscribe, and share with students, residents, nurses, paramedics, and healthcare professionals interested in emergency medicine and clinical pharmacology. See you in the next medical education video.